Hello everyone, hope you guys are doing great and staying safe. Welcome back to another webinar series from the Faculty of Medicine, Bioscience and Nursing. I'm Tan, the manager of Center for Clinical Skills Education and Training. If you are watching this, please do hit the like button and share it among your friends. Today's webinar will be focused on COVID-19 infection prevention and control. And let me introduce Associate Professor Dato Dr. Prathapa. He's a public health physician and also a former health director of the Perak State. He worked in the Ministry of Health for 40 years and joined MAHSA University in 2016 as an associate professor in community medicine. And he also specialized in communicable disease prevention and control. If you have a questions or comment, please drop it down below as we will address during Q&A session. Without further ado, let's hear it from Associate Professor Dr. Senan.
Hello everybody, good afternoon. Today we have an exciting topic that is current and a lot of confusion taking place everywhere on how disease is spread. I'll start off with a slideshow. Okay, COVID-19 strategies in prevention and control. This is our coronavirus, which has got a lot of rings around it, and name corona means a crown, so you can see a lot of crowns on top of it, and that's why it is called coronavirus. And this, they call it coronavirus 19 SARS-CoV-2. That's it for the virus. And the characteristics of the virus are it's enveloped single-strand RNA virus. RNA, our gene is always a DNA, so this is not a human strand gene, but it's a RNA virus. It has got a fatty envelope which can be destroyed by soap and water, or 60 to 75% ethanol. Ethanol is actually alcohol, and chlorine containing disinfectants. The inner protein core is denatured at temperatures of more than 70 degrees centigrade. Affects mainly respiratory tracts in the human beings. Common cold to MERS-CoV, SARS and SARS-CoV-19 are all from this family. The virus nucleotide is 79% similar to SARS, the original SARS that came in year 2003, and 52% similar to MERS-CoV. So if you had SARS before, you will have some immunity against SARS-CoV-19. Coronavirus disease started in 2019. It's an infectious disease caused by a newly discovered coronavirus. Severe acute respiratory syndrome, coronavirus 2, first reported to WHO on 31st December 2019 in Wuhan City, Hubei Province, China. On January 30th, 2020, the WHO declared the COVID-19 outbreak is a global health emergency. On March 11, 2020, it declared that COVID is a global pandemic. Okay. Current cases of COVID-19 in the world, 2610, 43,328,000 cases, and deaths 1,159,000, recovered 31 million have recovered. That means currently we have about 12 million cases that are active. For Malaysia, we have a total case of 26,565 plus another 1,000 yesterday. Recovered 17,000, and deaths 229 plus yesterday's death release. So figures keep changing every day. So this is what it was as of 26th of 10. Introduction. In the occurrence of a new disease, the initial challenges are we do not know what's the causative agent. There is no clear-cut criteria for clinical diagnosis. There is no test available to identify the agent. There is no idea of natural history of the disease, how history unfolds itself when you get it, when you develop the symptoms, what symptoms you develop first, then what happens next, what are the signs after that, and how does the disease progress. Okay, so when a new disease comes up, this is the dilemma that is faced by the clinician as well as the public health people. There is no idea of long-term implications. There's not many ideas on how it spreads, or there are too many ideas actually on how it spreads, because
Dato,
it depends on.
you might want to reshare your slides.
Oh, you can't get you don't see the slide?
Yes, Dato.
Should have told me earlier, Neman.
No, it just went off halfway, Dato. Then it nothing.
Okay. I'll share it again, no problem.
So guys, if you have any question, you can drop it to the comment.
Yeah.
As we will address it during the Q&A session. Meanwhile, we are sharing the slides.
Okay. Can you see now? Is it?
Yes.
Yeah. Okay. So I go to the main slides. Okay. Where did I stop? Earlier or this slide? This slide? Okay.
Yes, Dato.
There is no idea of the long-term implications, what happens, complications, and see some of them who are infected have now are complaining of other problems. There is many ideas on how it spreads, depending on who is telling you. Is it a virologist? Is it a public health person? Or is it the clinician? The incubation period of the disease is not known at that time. What is the period of communicability? How long you can pass the infection to another person? Is there any immunity? Okay. Now, if it's a new disease, you would not have any immunity, but like in SARS, you may have some cross immunity because of similar genetic material. Different definition. Coronavirus, a group of viruses that cause a variety of illnesses, including common cold and more serious respiratory conditions. COVID-19, the name given to the respiratory illness caused by the latest type of coronavirus. This particular type was identified in Wuhan. Self-isolation, definition is act of remaining in your own home and avoiding contact with other people, including your family members, as much as possible to reduce the spread of virus. Social distancing, action taken to mitigate the spread of disease by reducing people's contact with each other. Examples include closing schools, encouraging staff to work from home, and reducing the number of large-scale public gatherings, keeping oneself at a distance from one another, contact, spelling mistake, one another about 3 to 6 feet. Quarantine of persons is the restriction of activities or the separation of persons who are not ill but who may have been exposed to an infectious disease or agent or disease, with the objective of monitoring their symptoms and ensuring that early detection of cases. So once they develop symptoms, they are taken from the quarantine station and sent to a hospital. Isolation, which is the separation of ill or infected persons from others to prevent the spread of infection. So when a person is quarantined, develops symptoms, he is sent for isolation. He is isolated and sent to a hospital in Malaysia. Containment phase. steps introduced to prevent the virus from spreading for as long as possible, such as detecting early cases and trying to establish who the infected person has been in contact with. Okay, this is called also contact tracing. Delay phase measures introduced to reduce the peak impact of the virus and slow its spread, such as restrictions on public gatherings, lockdown, where people are not allowed to move freely and are required to stay at home for 14 days. Community transmission. When a person contracts the virus despite not having traveled to an affected area or not being in contact with someone known to have the disease. Actually, in a new disease, this should not happen because it's an imported disease. So if you are good, your contact tracing is good, this situation won't arise. Pandemic, a worldwide spread of disease, a new disease that causes epidemics in more than 3 continents is considered as a pandemic. Natural history of COVID-19 was virus infects mainly via inhaled droplets. The virus replicates in the oronasopharyngeal area. Incubation period from 3 days to 14 days. Median, that's more than 50, just 50% develop the symptoms by the 5th day. That's mean by median. Median 5 days is half of them develop the symptoms on the 5th day. Develops symptoms of fever and cough, develops pneumonia, develops respiratory distress, dies from multiple causes, or recovers with mild symptoms. Natural history again, 80% recover with mild disease, 15% moderate disease with pneumonia and recover, 5% need ICU care, intensive care unit care, and 1 to 2% of them pass away. Clinical presentation. Common clinical symptoms are fever, more than 38 degrees centigrade. 98% of them have fever. And cough, 76%. Fatigue, 47%. Expectoration, 28%. Expectoration means you cough out phlegm. That's expectoration. And diarrhea, 3%. Diarrhea is mainly because it's in the oropharynx region. You tend to swallow your saliva, and that's how it goes into your gut. So the infection is actually oropharynx, nasopharynx, but because it's oral, that means where the esophagus and the pharynx meet, or is a common area. So when just like any one of us, when you have a cough, if it's less little bit of saliva or expectoration, we used to swallow it. We don't spit it out. So when you don't spit it out, you swallow, and that disease goes down and causes diarrhea. Okay, difficulty in breathing leading to hypoxia within a week. Muscle, body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, and nausea or vomiting. These are minor symptoms. Okay, this is what happens to you. This is a graph which shows what happens when the infection comes. Infection is here, that means you got the virus from outside, either you inhaled it, okay, and it starts developing in your body. So it rises, the number of virus rises, and at the same time your body, after the short period of incubation, which is 3 to 14 days, your symptom comes up. You have a symptomatic, and this is where the antigen comes up. Okay, the product of the virus, antigen comes up and goes down together with the virus. In about 2 weeks, your body reacts to the invader. This is an outsider who comes in the body. You produce antibody. First antibody that is produced for the first time you get a disease is IgM antibodies. So IgM comes up. As it comes up, it sort of deactivates your virus. And then in about 2 to 3 weeks, you get IgG coming up. And IgM lasts for about a month or 6 weeks and it goes down. And this is the antibody that has memory and stays in your body for a long time. When you get your next antibody, next time you get a viral infection, you will get this IgG coming up immediately. That means as soon as you get the antigen, within a few days you have your antibody coming up, which shows that you can inactivate the viral and the antigen load faster. Okay, what are the tests available? PCR is a test that identifies the virus or antigen in your body. So it is valid from time 0 or few days after 0 to about 3 weeks. So the moment there is no virus, you can't get a positive test, antigen as well as PCR. You only get a positive test. Next is for IgM, which is the antibody test, which can only be positive after about 2 weeks and last to about 5 to 6 weeks. The next antibody test of IgG comes to you about 1 week later and lasts forever in your body until it comes down to a lower level. Okay, so these are the tests you should use. PCR tests in early phase of infection. Antibody test is appropriate for convalescent. That means you already recovered of the COVID in case of asymptomatic infection. Okay, so if you do if you do a PCR test when it's already about 4 weeks, you'll get a negative result, which doesn't mean that you did not have the disease. If you do antibody test, it will be positive, which says you had a disease about a month ago. So it depends on which test is used. So PCR test is the best test to detect a case early. Antibody tests are not efficient in this manner. What it takes to infect. To successfully infect you, the virus needs a dose of 1000 viral particles. The typical environmental spread of activities: you breathe, you every time you breathe, you give out about 20 viral particles per minute. Speaking, you give out 200 particles per minute. To reach 1000 viral particles, to make it effective, you need to spend at least 5 minutes. Okay, so if you're talking to somebody for more than who is speaking, he's giving a sermon, he's giving a talk, or he's leading he's at a mic, okay, giving a seminar or something, you can get it if you're sitting with him for more than 10 to 15 minutes. If you're nearby, too far away, you won't get it. So the distance of about 6 feet is also important here, but speaking also spews out more than if you breathe. Coughing and singing, not to forget singing, speaking, singing also comes out about the same. The cough, if you cough, you put out 200 million viral particles. Enough of these may remain in the air for hours, about 8 hours, in a poorly ventilated environment. Okay, sometimes this is because it's airborne or droplet spread. It can be kept in the air by ventilation. Your fan can keep it above, moving around more a bit longer than if there is no fan. Then it will settle faster. Sneeze is up to 200 million viral particles. You see, these two don't have a time. This is immediate. The moment you cough, it comes out. Here you have to spend some time with them. Formula is successful infection equals to exposure to virus and duration of exposure, and exposure to the amount of virus. Okay, that is important. So your disease progression, if you inhale the first, because it's a new disease, the first time when you come in contact with the virus, if you take in a lot of particles in your breathing, then you'll get a more severe disease. If you're exposed with less viral particles, you might, because the viral particles need to multiply in the body, it takes time, so you may have a milder disease. It's also dependent on your own immunity. Immunity is the ability to fight a disease. Okay, so in this case, your first viral dose is important, because the next viral dose is, if you're already infected, the next viral dose may not have much effect on you because of immunity. Therefore, you must not, if in this disease, which is a pandemic of a new disease, best to avoid high dose of infection. Low risk area scenarios are being in vicinity of someone with 6 feet distancing, low risk if limited to less than 45 minutes. Talking to someone face to face with mask, low risk if limited to less than 4 minutes. Someone passing or walking, jogging, cycling, very low risk. Ventilated spaces with distancing, low risk. Groceries shopping, medium risk, depends on how long you're spending there and how long you spend shopping. If you can keep it to less than 15 minutes, the chances of you getting is low, but it is reduced if you wear a mask. Okay, here we have to talk about the distancing without masking, distancing with masking. Distancing without masking is slightly higher risk, not to say high risk, slightly higher the risk if you're, but it's reduced when you wear a mask. High risk cases are indoor spaces where you spend some time with a person, public bathrooms, common areas, high formality, surface transfer. This is more in areas where there are patients staying. For example, in your isolation area or in the house before you're diagnosed. So formality transmission is more for hospital base and high risk base where the patients are around. That's where this surface transfer risk is high. Restaurants, high risk can reduce to medium risk by sitting outdoors with distancing and surface touch awareness. Very high risk, workplaces, schools, even with social distancing. Very high risk include high formality transfer risk. Parties, weddings, business networking, conferences, arenas, and concerts and cinemas. Because you spend time, this is all because the duration of time you spend there that it becomes high risk. Incubation period and period of communicability. Okay, incubation period is the time when you get the virus in your body till the time you develop symptoms. Here the first symptom is fever. So the moment you get a fever, from the time you get the virus, that is called incubation period. Varies from 2 to 14 days, usually 3 to 7 days with a median of 5 days. When half of them will get it in 5 days, while the other half is from 5 days to 14 days. Patient to become viral negative can take up to 37 days with median of 20 days. But however, WHO has declared that although the viral particles can be detectable, they are not infectious. So the disease cannot spread. Period of communicability is when can the virus come out of an infected person and spread to another person. So that is 1 or 2 days before appearance of symptoms till tested negative for virus. So as long as you're tested positive, you still have the virus. But you must understand, as earlier, this 1 to 2 days before appearance of symptoms is what we can call as asymptomatic spread of disease. This 1 to 2 days is the person himself doesn't know he has the virus, but he can spread it. In another 1 or 2 days, he will develop fever, by which time he can be diagnosed if there's a swab done on him. So these 2 days of non-symptom spread is the period that the disease can spread without being detected. Factors affecting infectiousness. Factors affecting infectiousness are viral load of the secretion from the index person. Whether it's a lot, he's spewing out a lot of virus when he coughs or talks or sings. Aerosol generation processes, distance of the index patient, first viral load that the person is exposed to, duration of contact, if you are going to stay with the person overnight, if you know the cases that occurs all over the world, which I'll be showing you some examples. They are spread in groups, not in individual. You father spreads to the family, a person in the working area who spends 8 hours working, and things like that. Okay, patient susceptibility is, it's not easily transmissible because it's a virus that came from an animal to man. The virus is not used to the human cell, so it is not easy for it to survive in human being. But because the viral load is high and you spend a lot of time getting the load inside you, that is how a person can get the disease. Patient susceptibility, age and comorbidities, as people say, low immunity status like diabetes, other diseases that you might have, as well as if you are taking anti-cancer drugs. Survival on surfaces. Okay, this is more good for theory, but practically, personally, I don't feel that much transmission occurs from surfaces in non-high risk areas. When I say non-high risk areas, is wards, hospitals, clinics, where you have the patients staying there. If he's coughing around, then you can have it on the surface. But from the surface to come to you by the hand is not so common. Different kind of surfaces, metal examples, doorknobs, jewelry, silverware, 5 days, wood, furniture, decking, 4 days, plastic samples, milk containers, detergent bottles, 2 to 3 days, stainless steel examples, refrigerator, pot pans, 2 to 3 days, cardboard, 24 hours, copper, 4 hours, aluminium, 2 to 8 hours. Okay. Personal preventive equipment, PPE. In the community, I'm talking about community. Okay, masks, N95, more for hospital situation where the load is high, viral load. Surgical ply and others include scarf, towel, social distancing 1 meter and more, or 3 feet to 4 feet, or 5 feet to 6 feet. Self-isolation if exposed, with self-referral if they develop any symptoms for testing. Now, this is where you also have to worry about, because self-isolation will expose the family to the disease. If you're completely isolated, self-isolation in the house from your family, because as I told, the 2 days before you get a symptom, because you only go to test after you get the symptoms. So you're exposing them the first 1 or 2 days when you're asymptomatic and you still can spread. Okay, just to tell you the effectiveness of mask. These are countries that did not encourage people to wear masks, while these are the countries where masks were used. So masks reduces the risk of transmission. Okay, so this is a proof that masks do work. Anything that prevents the droplets from going into your lungs works. Source of infection. Imported disease. First of all, you must understand this is an imported disease, a disease, new disease coming into your country. There is no immunity in the people and all are susceptible. Some may have, if you had SARS one in 2003, or MERS-CoV when you went to the Middle East. Okay, the severity of the disease dependent on the dose and duration of exposure. Masks reduce the dose of the infection. Since it's an imported new disease, your first dose will determine the severity of infection disease you're going to have. Cases come through the sea, air, land, and therefore need to prevent import of disease. The problem is illegal immigrants whom you do not know, who normally don't like to be seen and stay in the community, and when it's spread to a lot of people, then only it becomes evident that there is a disease. So the problem is illegal people coming into the country with the disease. Possibility of spread can be restricted if case and contacts are known and traced early, and quarantine, not home quarantine, it should be quarantine away from families. Breaking the chain. This photo has been shared by doctors in Greece. The one who stayed away saved all the rest. See, matches. These are burnt already, got disease, and this fellow separated. You can separate the disease that way. So if you don't, if you keep away from by social distancing, wearing mask, you won't be one of these burn cases. Spread in countries. Okay, religious activities. Singapore, Korea, Malaysia, USA, France. The first major disease in our country was due to a religious gathering, and because they didn't know where they came from, it was took time to identify the contacts and to look for cases, and that made the first disease spread, but has been well controlled now, and new cases have come up because of the election in Sabah. Okay, that is a next wave that has come up. Okay, now sports activities in US, Spain, Italy, Thailand, China, and Japan, where there is clusters from there. Nursing home, because they are staying in the same place, crowded area, and no movement of them, so they get spread among themselves. Now in Malaysia, we are having also in prisons as a cluster. Conferences and meetings can also spread. It's in Singapore, US. If you have a meeting for more than half an hour, the chances of spreading is there, because when you speak, you give out about, what was it just now? About 200 virus particles per minute, and if you speak for half an hour, you already got your 1,000 particles for the person to be infected. Okay, conference, pub, Japan and Thailand, because you spend a lot of time here. Once you go in, you don't know when you're coming out. Social gathering, Singapore, Australia. Cruise ship, schools, prisons, US, China, and Iran. Many more examples. Okay, closure of border and lockdown. Closure of border and lockdown is needed to identify where the cases and contacts are going to become cases that are present in a country. So when you lock down for 14 days, then the contacts who got the disease from the index case, or the case that we have defined as a case, will come up. That means at least 50% will come up within 5 days. As you know, the incubation period is 5 days. And the rest will come up in 14 days. By the 14th day, you will know which part of your country the cases are, plus your contacts that have been cases, you will be knowing. And once you know that, and you have removed the cases, so the danger from spread from the cases are low. As the moment the contacts become cases, you also remove them. That means if the quarantine and your isolation is done efficiently, and there is no influx coming in from, you're doing a screening of all the patients coming in, then the lockdown can be implemented only in the area. After that, you have to have only lockdowns in area where there are cases only. No need to have lockdown or big areas. You just lock down within the village, within the small town, and within a few, maybe 100 feet from the house of the person who is infected. That's all. Then the lockdown can be implemented in the areas where there are clusters, and if contact tracing is efficient, then the disease can be brought under control within a month. Can be done, okay, opening of borders can be done in disease-free areas, like New Zealand has no diseases, and if Malaysia don't have diseases, then you can have communication. In fact, it should not be done by countries because it's too big an area. It should be done by smaller areas. See, if the town of Penang, the town of Penang does, and the airport does not have a disease, you can easily have flights from similar areas in different parts of the country. Opening to inflow of air, sea and land will depend on testing and the quarantine capabilities and the ability to identify those that escape this process, starting between disease-free, well-controlled countries. Management of close contacts of confirmed case, healthcare associated exposure, including providing direct care for COVID-19 patients without using appropriate PPE, working with healthcare workers infected with COVID, visiting patients or staying in the same closed environment of COVID-19 patient, working together in close proximity or sharing the same classroom environment with the COVID-19 patient, traveling together in any conveyance, living in the same household. Okay, even this, you must only take the people who are within 10 feet of where they are seated, because the disease doesn't move around to catch people. So even if the person is breathing out, it's just within 6 to 10 feet of where he is. If he's seated in a bus, you need not worry about the passenger. If he's in front of the bus, you need not worry about the passenger who is at the back of the bus. Same in school. No? The person who has infected within 10 feet, you take them as the contacts. The rest, you have to observe to see whether they develop any symptoms. Now they have found out there are 3 strains of COVID-19, A, B and C. Type A is the one that started in Wuhan and spread to US, type A, and to Australia. And B, that is those that came derived from type A after mutation has gone to Europe. Okay, and type C is the daughter of type B. So A, B, C. C is the one that is also in, has come to Malaysia, Hong Kong, okay, and Singapore, and maybe Italy, type C, okay. Then there are some that came from India. Okay, this lady is a professor, Professor Leong Min Zil, who, if you have time, you go through this it just tells you what how effective is a virus is your vaccine going to be. By the time, according to her, by the time you develop a vaccine against one virus, it has changed to another virus. So please go through it if you're free, and she's quite a good eye opener for those who are not exposed to vaccine preparation. That's all from me. Thank you very much. Okay, to get the real-time stats COVID-19, you can go to this Worldometers info. Thank you very much. That's all I have to say today. Thank you for listening. Now
Thank you, Prof Dato Dr. Senan. If you have any question, please drop it in the comment section as we will address it, and Prof Dato Dr. Senan will answer all of your questions. Any questions? Anyone? Any volunteers? Any questions? No. So So by that, I would like to take this opportunity to introduce the offered program by the School of Medicines, including the Master of Science in Public Health, Master of Science in Public Health ODL, Master of Medical Science, Master of Medical Science Anatomy, Bachelor of Medicine, and Bachelor of Surgery. Also, Diploma in Paramedical Science. So, if you have any questions about our program offered, so you may contact this. You may go to www.mahsaedu.my and also email to our marketing at mahsa.edu.my. Also, we have leave the phone number and also register your interest for our immersion day. By that, I would like to thank Dato Senan for attending this COVID-19 infection prevention and control. And stay safe, everyone. Please follow our MAHSA University Facebook page for further updates in our webinar, also events. Thank you. Thank you, Dato.
Thank you, Mr. Tan. Thank you for the opportunity.
Thank you.
Thank you.